The issue of that whether these are really serious disorders or fads or a bunch of rich brats or whatever the case may be, I think one needs to better inform the public about the seriousness of these disorders, the high mortality rate associated with eating disorders. We involved in a study following 246 women with anorexia and bulimia. Now in the 25th year of the study, in the first 20 years, 16 women, 14 with anorexia nervosa have died. These are young women. So I think being able to talk about the seriousness of this, I think talking about the impairment, not just in terms of loss of life, but in terms of jobs, in terms of opportunities for social relationships, the impact on family, on siblings, has been tremendous, and I think that education needs to be out there.
You know, a lot of people, I think, tend to believe it's a model disease.
Yeah, and even with the model disease, let me be clear. I mean, I think there's some populations that may be at greater risk, whether they be certain kinds of athletes that are involved with that where body habit is so important, or models, or broadcast people who are out there in the public, or the individuals who are more competitive, so that you don't you find them in the most competitive circles, and maybe in the most competitive schools and so forth. I think that people need to understand that what we're seeing is an increasing number of people with eating disorders across a tremendous age range. So we're seeing individuals, children, 8, 9, 10 with eating disorders, those who are adults who are in their 60s and 70s with eating disorders. We're seeing increasing numbers in across minorities. And so I think, again, there needs to be more public education.